Hi, I'm Dr. Sharbell Hashoul, and today we're clearing up some of the most common myths about breast cancer that I hear all the time. There's so much information out there, and honestly, some of it is just plain wrong, and it can cause unnecessary worry or worse, false reassurance. So let's go through a few of the big ones calmly and clearly. Myth number one: deodorant or antiperspirant causes breast cancer. This idea has been around for years, but large scientific studies have not found a link between using deodorant and developing breast cancer. There's no solid evidence that the aluminum or other ingredients in these products cause cancer cells to form. It's completely understandable why this myth spreads, since deodorant is applied so close to the breast area, but the research simply doesn't support it. Myth number two: underwire bras cause breast cancer. This one sounds almost logical, the idea that a tight bra restricts lymph flow and somehow traps toxins, but there is no biological mechanism or research evidence to back this up. You can choose whatever bra is comfortable for you without worrying it's affecting your cancer risk. Myth number three: only women with a family history need to worry about breast cancer. This is an important one to correct. It's true that having a close relative, like a mother or sister, with breast cancer does raise your personal risk. But here's the reality. Most people diagnosed with breast cancer have no family history of it at all. Breast cancer can happen to anyone with breast tissue, regardless of what runs in the family. So skipping screening just because no one in your family has had it isn't a safe assumption. Myth number four: if you don't feel a lump, you're fine. Lumps are one possible sign, but they are not the only sign. And early breast cancer often causes no symptoms you can feel at all. That's actually the whole reason mammograms exist. They can pick up changes long before anything is noticeable by touch. Other possible signs can include changes in breast size or shape, skin dimpling, nipple changes, or unusual discharge. But again, early cancer frequently shows no outward signs whatsoever. Myth number five: only older women get breast cancer. Age is the single biggest risk factor, and it's true that risk increases as we get older. But breast cancer can and does occur in younger women too, including women in their 20s and 30s, even though it's less common. This is why paying attention to your body and following recommended screening guidelines for your age and risk level matters at every stage of life. Myth number six: having small breasts means lower risk. Breast cancer risk isn't determined by breast size. It develops from breast tissue itself, specifically the cells lining the ducts or lobules, and everyone with breast tissue has some baseline risk, regardless of how much or how little tissue they have. Myth number seven: a mammogram can cause cancer to spread. This is a fear I hear often, and it makes sense why. The idea of compression somehow disturbing cancer cells is scary to imagine. But there is no scientific evidence that the pressure from a mammogram causes cancer to spread. Mammograms use a very small, carefully regulated dose of radiation, and for most people, the benefit of catching cancer early far outweighs any theoretical risk from the imaging itself. Myth number eight: a breast cancer diagnosis is always the same and always means the same treatment path. In reality, breast cancer isn't just one disease. There are many different types, growth patterns, and biological characteristics, which is why treatment is so individualized. What applies to one person's diagnosis may not apply to someone else's at all. So what's the practical takeaway here? Don't rely on rumors, social media posts, or well-meaning but inaccurate advice from friends and family to make decisions about your breast health. Instead, follow the screening guidelines appropriate for your age and personal risk. Get familiar with how your own breasts normally look and feel so you can notice changes and bring any questions, no matter how small they seem, to your own doctor. They can look at your personal history and give you guidance that actually applies to you. That's it for today. Breast health doesn't have to be confusing or frightening. It just takes good information and a good conversation with your doctor. Take care, and I'll see you in the next video.